So to everyone present here today, to our speakers, our media friends, our colleagues in the health sector, and to everyone tuning in via the DOH Facebook and YouTube pages, a pleasant morning to everyone. Ako po si Jaren Mateo, ang inyong makakasama para sa ating kapihan session sa umagang ito. So actually, this Kapihan session is extra special because we are also celebrating this year's World Immunization Week. So first off, I would like to thank our speakers today for taking precious time to share with all of us their expertise regarding the topic. So I guess for everyone tuning in with us today, you're probably wondering, no? So sino nga ba itong mga speakers natin? Well, allow me to introduce them to all of you. So joining us today are Dr. Joanna K. Boralio. So Dr. Boralio obtained her medical degree in the University of the Philippines, Manila, and had her medical practice at the Philippine General Hospital. So shortly after, last 2021, Dr. Boralio joined the National Immunization Program under the Disease Prevention and Control Bureau of the DOH. So good morning po, Dr. Joanna.
So good morning po, Doc Jare, and everyone po in the public and our media partners. So thank you for welcoming me for this Kapihan session.
Yeah, thank you din po, Dr. Joanna. So our next speaker for today is Dr. Faith Villanueva, who is a consultant of the Internal Medicine and Infectious Diseases for medical institutions such as the Chonghua Hospital, both in Cebu City and Mandaue City. And she is also the co-chair for the Adult Immunization Program, Immunization Committee rather, for the Philippine Society for Microbiology and Infectious Diseases. She also led the team of the COVID-19 vaccination team at the Chonghua Hospital. So Dr. Faith, good morning po.
Good morning everyone. Magandang umaga sa lahat.
So before we start our Kapihan session, a friendly reminder to our media friends, we can type in our questions for our speakers via the Zoom chat box. And we also encourage everyone to ask questions relating to the discussion to be given by our speakers. Malinaw po ba yun, ating media partners? Ayan. So let us not prolong the excitement any longer. So I now give the floor to Dr. Joanna for her discussion about the Chikiting vaccination program for a catch-up on our children's routine vaccines. So Dr. Joanna.
Yes, thank you, Jaren. So let me share my screen. So again, magandang umaga po sa lahat sa ating media partners and the general public. I am Dr. Joanna K. Boralio, Medical Officer 3 of the National Immunization Program. And in behalf of Dr. Kim Tejano, our Program Manager, I'll be the one to discuss our forthcoming Chikiting Vaccination Days or our National Vaccination Days for routine and catch-up immunization. So let me start off by giving a quick background on why we are conducting this campaign and an overview on how the Chikiting Vaccination Days will go through. So based on the partial surveillance data of the Epidemiology Bureau for the year 2021, all the regions have reported measles cases. So this is, as you can see on the spot map on your left side, where all of the areas are lighted with shades of red. So noticeable also in the report is that most of the measles cases are actually 6 to 59 months old that are unvaccinated or with unknown vaccination status. So this translates to a huge amount of cohorts that are really susceptible to vaccine-preventable diseases or VPDs such as measles. So again, having mentioned the huge number of susceptible cohorts, an outbreak is really imminent because added to this, the country now also has increased mobility of the general public as COVID-19 cases go down and mobility restrictions are eased. So this means that infectious diseases transmission, may it be COVID-19 or actually vaccine-preventable diseases, is more likely to happen. So lastly, there is also the problem of having a relative poor surveillance of our VPDs that adds to the possibility of having an outbreak. So in order to prevent the continuous rise in the number of vaccine-preventable diseases, such as measles, the Department of Health, DOH, through the National Immunization Program, or NIP, will launch the Chikiting Vaccination Days. Again, it is a National Vaccination Days for routine and catch-up immunization. So this is guided by the Department Memorandum 2022-0147, which is recently released and signed. So for the key beneficiaries of this campaign, we are targeting to vaccinate the remaining 0 to 12 months old children from 2021, which is around 1,100,000 children, and also included to be vaccinated in the campaign are 0 to 12 months old children who are eligible for the year 2022. So in short, our target is 0 to 23 months old children who have missed their vaccination or who are zero-dose children. So yung missed vaccination po natin, meaning nakapagbakuna sila before pero hindi lang po natuloy yung schedule, and yung ating mga zero-dose children, which is yung wala po talagang natanggap na bakuna simula nung pagkapanganak po nila. So ito po yung target po natin, 0 to 23 months old children who are zero-dose and missed children. So in this campaign, we hope to be successful by bringing again the whole society and whole of government approach. So this was done and is continuously being done in the COVID-19 vaccination as well as yung previous nating mga campaigns for the non-COVID vaccinations. So for example, private sectors and government hospitals may partner with the Centers for Health Developments for service delivery or sa actual na pagbabakuna po natin and or demand generation or yung ating mga advocacy activities. So for this campaign, this will be held every last Thursdays and Fridays of the months of April, May, and June. So this is aside po sa ating Bakuna Wednesdays, which is po yung ating designated na National Vaccination Days for routine immunization. So the target for this campaign for the months of April, May, June in total is at least 80% per antigen for the remaining targets. Then specifically, here is our schedule for the Chikiting Vaccination Days. So on April 28, which is tomorrow, to 29, we are targeting to launch the Chikiting Vaccination Days in initial provinces and cities. So these are the priority areas which has the highest unvaccinated children based on our partial data during the 2021 reports. And then on May 26, 27, as well as in June 23 and 24, we will be conducting the Chikiting Vaccination Days nationwide. So I think that's it. Again, thank you very much. And let's encourage every mother and child to get vaccinated para sa healthy Pilipinas. At dahil Immunization Week din po, ating isabuhay ang tema natin ngayon taon na Long Life for All, kaya sa Healthy Pilipinas, magpabakuna na. Thank you.
Maraming salamat po, Dr. Joanna, for that very thorough discussion po regarding our Chikiting Vaccination Program. I'm sure upon hearing your presentation, yung mga mommies, daddies, guardians na nakikinig sa atin ngayon, very excited na rin talagang bakunahan ang kanilang mga bagets, no? Yan. So thank you po ulit, Dr. Joanna. So for our next speaker, Dr. Faith Villanueva will be discussing about adult vaccination naman, specifically for pneumonia and flu. Good morning po, Dr. Faith.
Hello, good morning again. And let me just share my slides. Is it on?
Yes po, we can see the screen na po, Dr. Faith.
Okay, so let me do this. Okay. Good morning once again, and I will be shifting to adult vaccination. First of all, thank you very much for the invitation to talk about influenza and pneumonia vaccination for adults. So indeed, it is very important to talk about this vaccination because they have a very important role in improving the lives of the adult immunocompromised patients. Let me start by presenting to you this table by the Advisory Committee on Immunization Practices. It might seem like a very busy table, but this is just to show you the 12 vaccines that are recommended for the adult population. We have always been very aware of the vaccines for the chickitings, for the youngs, but this is just to show everybody that there are 12 vaccines that are recommended for the general population, for the general adult population, as well as adult population with certain medical conditions and risk factors. Kasama na dito yung influenza vaccine at saka yung pneumococcal vaccine. So both vaccines are recommended for the general population. They are also recommended for populations with medical conditions, including pregnancy, immunocompromising conditions, those with HIV/AIDS, those with a condition we call asplenia, yung tinanggal yung spleen, those with end-stage kidney problems, those with chronic lung diseases, heart diseases, those with alcoholism, those with chronic liver diseases, diabetes, and then the same vaccines are recommended for all our healthcare workers, and another group of another population we call MSM, or men who have sex with men. Okay, so now let's shift to influenza. So shown in this slide is the burden of illness of influenza. On the left is the burden of illness in the Philippines as gleaned from the report from the Philippine Integrated Disease Surveillance Response, or PIDSAR. In this slide, you are presented the report from January 1 to July 3, 2021, compared with the 2020 report of the same time frame. So from January 1 to July 3, 2021, a total more than 35,000 cases of influenza-like illnesses were reported to PIDSAR, and this included, excuse me, 274 deaths. There was a 10% decrease from the cases reported in the same time frame in 2020. On the right side, you see the 2021-2022 preliminary in-season burden estimates for flu in the US. So the Centers for Disease and Control estimates that from October 1, 2021 to April 16, 2022, there have been 4.7 to 7.9 million flu illnesses, 2.2 to 3.6 million medical visits or consultations for the flu. There have been 47,000 to 96,000 flu hospitalizations, and for the large parts, these are the elderly and those with immunocompromising conditions. And there have been 2,800 and 8,200 flu deaths. So all in all, we can say that influenza or flu remains a public health concern in the country, in the Philippines, in the US, and globally. So that brings us to the discussion on the importance of the flu vaccine. So the flu vaccine is also known as influenza vaccine. This is a vaccine that provides protection for influenza virus A and B. These viruses are transmitted mainly by droplets and aerosols from respiratory secretions of infected individuals. They cause both seasonal influenza epidemics as well as out-of-season sporadic cases and outbreaks. Here in the country, in the Philippines, a tropical country, we have rains almost every month. We have typhoons almost every month. This is brought about by what we call climate change. So in the country, we always tell people, educate the lay, our patients, that flu is basically a year-round occurrence. So the soonest you can get the flu vaccine, the better. The influenza virus A and B can cause complications like infection in the ear called otitis media. It can cause viral pneumonia. It can cause secondary bacterial pneumonia, and then exacerbations of chronic lung diseases for those who have chronic lung conditions. Originally, the flu vaccine was a bivalent vaccine, meaning it contained surface proteins of the two circulating influenza viral strains then. And then with continuous surveillance of predominant circulating viral strains, it evolved into a trivalent vaccine. And currently, we have the quadrivalent influenza or flu vaccine. The current flu vaccine contains surface antigens covering for the predominant viral strains, namely A, H1N1, A, H3, and 2, and both B viruses, the Victoria and Yamagata lines. For the summary of evidence of the influenza or flu vaccine, the injectable inactivated flu vaccine has a 60% efficacy rate in preventing influenza. And when the vaccine contents match the circulating strains, the efficacy is 62%. The nasal live attenuated flu vaccine has a lower efficacy rate, although the data on actual efficacy rate is very difficult to find. But in one study in the UK among children, the efficacy is 57.6%. In the USA, there is no effectiveness estimates for 2018 to 2019, mainly because of the limited use of the nasal flu vaccine, mainly because the injectable flu vaccines are the more preferred vaccines. The available influenza vaccine in the Philippines, as I said, is the quadrivalent influenza vaccine. It is recommended to be given annually every year because the strains differ every year. It is administered intramuscularly, and the common side effects are tenderness and soreness at the injection site, which is the usual expected side effects for any injectable vaccine. The only contraindication to the vaccine is a severe allergic reaction to any vaccine component or an allergic reaction to a previous similar flu vaccine. So for these patients, for these individuals, they should not be given the flu vaccine unless there is really a need for it. It becomes a shared decision-making between the patient and the doctor if indeed it will be given. We do have precaution for administering the influenza vaccine, meaning we do not or we hold it off if the individual presents with moderate to severe illness with or without fever. The flu vaccine can be given during the second and third trimesters of pregnancy. There is not much data, no clinical studies done during the first trimesters of pregnancy, so it cannot be recommended during the first trimester. And then it can also be given to those women who are planning to get pregnant during the influenza season. So as I presented this to you earlier, the inactivated flu vaccine is recommended for adult individuals from 19 years old to 65 years old and above. Now let's shift to the pneumococcal vaccine. When we say pneumococcal vaccine, it's very important to clarify that pneumococcal refers to the action of the vaccine against Streptococcus pneumoniae, which is the bacterial etiologic agent of pneumonia. It is not a vaccine that is specific for pneumonia alone, because Streptococcus pneumoniae can cause other infections aside from pneumonia. It can cause ear infection, and more importantly, it can cause what we call invasive pneumococcal disease, or IPD, in the form of bacteremia, meningitis or infection in the brain, endocarditis, infection in the heart, peritonitis, infection in the abdominal organs, and then even arthritis and infections outside the lung parenchyma. And the invasive pneumococcal disease is the primary target of the vaccine more than the pneumonia itself. This slide, I wanted to present this to you because this is just to show you that even before the introduction of the newly formulated pneumonia vaccine, the PCV13, which I will be discussing more later on, it was already shown that from 2007 to 2010, these were the numbers of the invasive pneumococcal pneumonia among the invasive pneumococcal disease among adult patients. No, you have here those that are covered by the PCV13 serotypes and those the other serotypes. So these are the case, the incidence, the number of cases per 100,000 population. When they introduced the PCV13 for children in 2010, on top of the original pneumonia vaccine, which was the PPSV23, it showed a remarkable decrease in the cases of invasive pneumococcal disease, not just in children, but even the indirect effects seen on the adults. So because of this data, the PCV13 was introduced for the adult population 65 years old and above with immunocompromising condition. This was introduced in 2014, and once again, remarkably, amazingly, it showed remarkable decrease in the incidence of invasive pneumococcal disease, so that by 2019, the ACIP recommended the introduction of PCV13, not just for 65 years old and above with immunocompromising conditions, but the general population of elderly population of 65 years old and above. So the Streptococcus pneumoniae contained in the different vaccines available in the Philippines are listed here because we have two types of vaccines available currently. We have the 23-valent pneumococcal polysaccharide vaccine and then the 13-valent pneumococcal conjugate vaccine. So these are the Streptococcus pneumoniae serotypes covered by the vaccines. And on the right column is a data from the study of Dr. Kapihan, published in 2014, that determined the predominant serotypes in the Philippines. And these are the predominant serotypes. And if you notice, these serotypes are actually covered by either the 23-valent, the PPSV23, and the PCV13. So we are good as far as coverage of the available pneumococcal vaccines in the Philippines. Our predominant serotypes in the Philippines are effectively covered. For the summary of evidence for the pneumococcal vaccines, in terms of prevention of pneumonia, the odds ratio of preventing pneumonia using the PPSV23 is 0.72% compared to 0.95% using the PCV13. In terms of preventing invasive pneumococcal disease, the odds ratio for using PPSV23 is 0.26 compared to 0.51 with using PCV13. So when we say odds ratio more than 1 indicates increased occurrence of an event, but the odds ratio less than 1 indicates decreased occurrence of an event, so protective exposure. And then in terms of mortality, the odds ratio with PPSV23 is 0.9, while that of PCV13 is 1. So in the Philippines, the recommended pneumococcal vaccines is either PPSV23 and PCV13, and these are the schedules as recommended in the local guidelines, local clinical practice guidelines on immunization. These vaccines are given intramuscularly, as with the flu vaccine. The common adverse events are the non-specific redness, swelling, and soreness at the injection site. They may be fever, malaise, and then generalized muscle pains, and then allergic reactions. Same with the flu vaccine, the only contraindication is severe allergic reaction to any vaccine component or to a previous dose. And we do hold off the pneumococcal vaccine in the individuals presenting to us asking for the vaccine who presents with moderate to severe illness with or without fever. The pneumococcal vaccines can be given during pregnancy, although safety in the first trimester has not been evaluated. And there is no data for PCV13 as far as pregnancy and breastfeeding is concerned. Now, the update that I want to highlight in this short lecture is that in 2021, in October 2021, the US FDA approved for use the 15-valent and the 20-valent pneumococcal conjugate vaccine. And as stated shown in this slide, basically the advantages are more coverages for more serotypes of Streptococcus pneumoniae. Now, these vaccines are not available yet in the Philippines, but they will be available soon. And we hope they will become available because these vaccines will make the immunization schedule for pneumococcal vaccine easier, because it's either you use the 15-valent and then you give a 20-valent, or you give a PPSB 1 year after, or you use the 20-valent with 1 dose only, no further doses needed, and that will confer lifetime protection against Streptococcus pneumoniae. For the summary of evidence for the pneumococcal vaccine, as far as immunogenicity is concerned, the PCV15 and PCV20 is non-inferior to both PCV13 and the PPSV23. They have more significant, greater efficacy against serotypes that are not found in the previous formulations of the vaccine. As far as safety is concerned, serious adverse event rate is 2.5% with PCV15 and 1.5% with PCV20. And then the most common adverse events are enumerated here. They are not different from the previous, from the adverse events we associate with the influenza and the current pneumonia vaccines. So just to show you once again that the pneumococcal vaccine is recommended for 19 years old up to 65 years old and above. And also for those who have any of the medical conditions as discussed earlier. So to summarize, my last slide, vaccines save lives. We encourage everyone to get yourselves vaccinated. This is the word from the WHO. Vaccines bring us closer to a world where no one suffers or dies from a vaccine-preventable disease. So if the vaccine is available locally, we must offer it to eligible individuals, and we must ensure that it is given properly to these individuals. Thank you very much for your attention.
Maraming salamat po, Dr. Faith, para sa inyong very comprehensive presentation regarding adult vaccinations. So I'm sure for the adult population na nakikinig sa atin ngayon, nakita talaga nila yung importance of getting vaccinated against vaccine preventable diseases. So dahil dyan, let us now proceed to our Q&A portion. So we will first, we will be asking the questions sent in by our media partners, and then we will be proceeding to the live question submitted via the Zoom chat box. So I'm sure naman, Dr. Faith and Dr. Joanna, na kayang-kaya nating sagutin itong mga katanungan dito confidently, beautiful with a heart. Diba? So kayang-kaya yan. So ang ating first question comes from Sheila Crisostomo from the Philippine Star. So, ano pong regions and provinces ang mababa pa din ang non-COVID vaccination rates? Bakit and please provide comparative figures. Ayan. So, if ever Dr. Joanna or Dr. Faith can chime in and add into each other's answers.
I think I have to give the floor to Dr. Joanna for that.
Sige po, Doc Faith. So for this po, I'll be speaking in the field of child immunization, since yun po yung focus ko kanina nung aking discussion. So as presented kanina, halos lahat ng regions and provinces ay mababa pa din ang non-COVID vaccination rates. So dito po kasama sa atin yung mga oral polio vaccines, yung mga pneumonia vaccines para sa bata, yung mga measles vaccine. Kaya po tayo nagla-launch ng ating Chikiting Vaccination Days para po ma-focus yung ating mga resources dun sa araw na yon para mabakunahan po yung mga hindi nabakunahan last year. So, gaya po na pinakita ko sa kanina, yung mga prioritized areas po this April po sa ating Chikiting Vaccination Days, yun po yung talaga yung may mga maraming unvaccinated children. So, sila po yung kulang yung kumpleto yung bakuna ng mga bata. So, base po sa data namin, halos 5 hanggang 10,000 yung sanggol na di nabakunahan para dito sa mga lugar na po na to. So yun lang po yung aking masasabi para po sa child vaccination po. Thank you.
I think if I may add to that, isa yan sa mga challenges dito sa Pilipinas. Actually, kulang tayo sa data on adult vaccination rates. Yeah, Joanna, no? I think that is something that we should, and then understandable naman kasi yan, kasi sa national immunization program natin, ang target naman talaga natin yung mga chikiting. Pero parang we really need, I really do not know if the DOH has programs to strengthen the surveillance of immunization among the adults, because if we do have that, meron tayong data niyan, malaking tulong kasi yan sa pag create ng immunization program for the adults. Sa ibang bansa kasi, sa US, sa UK, maganda yung surveillance program nila including the adults.
Thank you po, Dr. Joanna and Dr. Faith, for answering that question po from Sheila Crisostomo. So our next question is, bakit po sinasabing critical ang pagpabakuna sa pag-prevent ng pagkakaroon ng future outbreaks?
So I'll be going na lang din po ulit mauna ako, Doc Tate. So, important po kasi yung bakuna kasi hindi lang po actually sarili natin yung napoprotektahan natin sa pagbabakuna. Kumbaga po, pag may enough po na tao na nabakunahan kontra sa mga vaccine-preventable diseases, napipigilan po nito yung pagkalat or yung transmission po na tinatawag natin. So, para po dito, ito po yung konsepto ng herd immunity po na marahil ay alam na po ng karamihan sa atin. Kaya nga po, dapat may certain number po tayo na mabakunahan kada bakuna po na meron tayo. Ito po yung nagpipigil ng ating mga transmission sa komunidad. Yun po. Thank you po.
So Dr. Faith, would you like to add to that po?
Actually, pare-pareho lang yung message. And then, nade-demonstrate natin ito sa current situation natin sa pandemic, di ba? We are urging everyone to get themselves vaccinated against the COVID vaccine, against the COVID-19. And then nakita naman natin na nang tumaas yung vaccination rate natin, talagang bumaba yung cases kasi nagkaroon tayo ng population immunity. Nagkaroon tayo ng magandang what we call protective immunity sa population. And somehow that has prevented the virus from infecting the susceptible individuals. And eventually, ang hope kasi natin na wala na talagang individual na mai-infect and virus. And then the pandemic will end. And then that can be extrapolated with the same bacteria or pathogens or viruses na nagkukos ng mga infection.
Thank you po, Dr. Faith, for adding to that answer of Dr. Joanna po. So our next question po, kung sakaling makakamiss ang infant ng bakuna, gaano katagal ang interval upang masundan ito? May posibilidad po bang mag-start over sa 5 visits kung hindi agad mapapabakunahan ang bata? So Dr. Joanna, you can start off po with the question.
Yes pa. So for routine immunization, importante po talaga na alam natin kung ano yung schedule po ng pagbabakuna natin. Kaya nga po tayo may binibigay na immunization card or yung ating mga baby book sa ating mga nanay. Tapos bukod pa doon, may sariling copy po or record din ng ating mga RHUs para po talaga i-counter na lang po or i-validate kung ano na lang po yung mga na-miss na nabakuna. Pero po, kung na-miss naman po yung bakuna at hindi na po talaga mahanap kung ano yung mga nabakunahan para kay baby, hindi naman po kailangan na i-restart po lahat. So, titingnan po natin kung ano yung mga appropriate na mga bakuna na pwede pang ibigay sa kanila. Kasi yung mga bakuna po natin, may mga age specific po sila na kailangan ibigay. So, for example, yung BCG hanggang 12 months old lang po. So, hindi siya pwedeng ibigay kapag dumating yung bata ng at least lagpas na ng 12 years old. So, kailangan appropriate pa rin po yung mga bakuna na ibibigay natin kapag bumalik na yung bata. So, yun lang po. Thank you.
So, Dr. Faith, would you like to add to Dr. Joanna's answer po?
Sa adult naman, ang general principle is, this is not to say na gawin natin, no? Pero ang general principle is, pwede naman ma-delayed yung second dose. From the first dose, hindi kailangan mag-start ng first dose na naman kung na-miss yung second dose, no? Pero merong mga certain diseases, like for example, hepatitis B, na for example, kung nabakunahan yung tao, tapos hindi na siya nakabalik for the second, if merong ang hepatitis B, meron kasing antibody test na pwedeng gawin to determine kung maganda pa yung immunity. Kasi kung mataas pa naman yung immunity, it becomes a shared decision making between the individual and the doctor kung itutuloy pa ba yung second or hindi na, or kailangan talagang mag-umpisa ng first dose and then move forward.
Thank you po, Dr. Faith, for that very comprehensive answer po. Para at least meron ding perspective regarding adult vaccination for that question also. I think it's very, very important also that we cover all bases, no? So for our next question from Sheila Crisostomo of the Philippine Star, anong areas ang may mataas na kaso ng measles ngayon at ano ang ginagawa ng DOH para mapigilan ito?
So Thank you po sa tanong ulit, Ma'am Sheila. So, gaya po ng aking nabanggit kanina, lahat ng rehiyon ay actually mayroong measles cases. Pero kung magbabanggit ako ng areas na mataas po ang cases talaga ng measles, ito po yung ating mga highly urbanized areas, kagaya po ng NCR and Region 4A. Ngayon po, para ma-address ito, patuloy pa rin naman po yung pagbabakuna natin sa routine immunization. Kumbaga, kailangan lang po talaga natin i-intensify yung efforts, kaya po tayo nag-campaign ngayon for Chikiting Vaccination Days para nga po mabakunahan pa yung hindi nakakuha ng bakuna noong nakaraang taon. Tapos sa surveillance naman po, pinag-iiting natin yung pag-test ng mga vaccine preventable diseases para masubaybayan po talaga natin kung ilan na po yung mga kaso sa ating mga LGUs. Yun po, salamat po.
Thank you po, Dr. Joanna, for answering that question po. Would Dr. Faith also like to add po regarding naman sa adult vaccination perspective naman po regarding that?
Actually, I don't have an answer to that because
Okay.
I don't have the surveillance numbers for measles among adults.
Okay po, sige. Noted on that. Thank you po, Dr. Faith. So for our next question po, again from Sheila Crisostomo, other than those presented, may areas po ba na nakitaan ng acute flaccid paralysis cases?
So yes po, may mga reports po tayo based sa ating partial data ng may acute flaccid paralysis. Pero sa kasalukuyan po, wala po tayo nakikita ng mga kaso na ito ay related sa polio. Pero gayon pa man po, wag tayong maging kampante at kumbaga magpabakuna pa rin po kasi maaari po magkaroon po ulit ng resurgence ng polio cases at magkaroon po muli ng outbreak. Lalo na po ngayon, last year, kaka-close lang po natin ng ating polio outbreak. So ngayon po, dapat tuloy-tuloy pa rin po para ma-maintain natin yung immunity po natin against sa polio po. Thank you. Back to you po, Sir Darren.
Okay, thank you po, Dr. Joanna. So our next question po, I think Dr. Faith also po can answer this one po, no? How important are adult vaccinations, knowing that most people are under the assumption that after pediatric vaccinations, they are usually set for life? Does this mean that there is waning immunity of these vaccinations po?
Tama po. You basically answered your question. As we grow old, indeed, nabakunahan tayo when we were young. And then as we go old, expected naman yan na the immunity we got from the bakuna, nagwi-wane yan. Although, and then majority naman nakaka-sustain ng immunity, protective immunity, pero meron talagang waning of the immunity. So that is the reason why kasama yung adult vaccination in the recommendations. No? It is important, most especially for the older population, and then the older population with medical comorbidities, and pwede din for those younger than 65 but with comorbidities. Parami na kasi yung mga pasyente na nagkaka-diabetes, nagkakaroon ng chronic lung diseases, nagkakaroon ng mga heart diseases. So ito yung mga pasyente or mga tao na talagang prone to infection. And then pag nagka-infection sila, lalala yung mga underlying comorbidities nila. So makakatulong in terms of improving their lives and in terms of preventing morbidity or mga serious infections in their lifetime, yung bakuna pang-adults.
Thank you po, Dr. Faith, for giving clarification on that question kasi I think it really is a common notion po among adults din na okay na napabakuna na ako nung bata so bakit pa ako magpapabakuna ngayong adult na ako, di ba? So I think it's very important also to note na immunity wanes talaga over time and we really should get with our continuous regular vaccinations talaga kahit over time, syempre, pagtanda natin, iba-iba na yung kinakailangan ng katawan natin. So I really think that's really important. So our next question po from Sheila Crisostomo also, gaano po kaimportante na magpa-vaccinate against flu and pneumonia sa panahon ng pandemya? May pagbaba po ba sa uptake ng adult vaccination versus flu and pneumonia ng nakaraang 2 taon? At the same time, meron po bang pagtaas ng kaso?
Thank you very much for that question, Miss Sheila. Actually, that's a very nice question. And then ang sagot kasi niyan, amazingly, during the 2-year pandemic, ang nire-report sa mga published data is that bumaba talaga yung incidence of flu, no? And then in-explain nila to, meron several explanations there, pero basically, during the pandemic times, we were all wearing our masks, we were wearing our face shields, we were staying at home. So talagang bumaba yung transmission ng influenza. And then ang pneumonia naman kasi hindi naman exclusively yung bacterial pneumonia, I mean, hindi naman yan exclusive na complication ng flu, but rather tumataas ang incidence of pneumonia in somebody who has an upper respiratory tract infection like the flu. Parang more common na it will develop into a secondary bacterial pneumonia. So same as with the influenza, during the pandemic time, the past 2 years, talagang bumaba yung incidence of both pneumonia and flu. And once again, ang sa nababasa ko, ang palagi nilang ini-explain is basically it prevented exposure to these pathogens, mainly because of the masking, the distancing, and then the staying at home. So ang babantayan natin ngayon, now na alert level 1, people are going out, and then more people are removing the face shields, but they are maintain the mask. People are interacting more, people are grouping more, meeting more. Ito yung babantayan natin in terms of the uptick in the flu and then the uptick of bacterial pneumonia. So importante, I think bottom line, even if we did see a decrease in the number of flu and bacteria during the pandemic time, it does not mean that we should not go and get the flu vaccines for ourselves, because now that we are opening, we are easing out, the numbers for flu and secondary bacterial pneumonia can actually go up again. So better to have ourselves protected from them by getting the vaccines.
Thank you po, Dr. Faith, for shedding light on that question, and thank you also for the gentle reminder to always observe minimum public health protocol, since yun nga hindi naman din natin talaga masasabi yung pag-atake ng mga bacteria, ng virus. Syempre, now that we are experiencing more mobility with alert level 1, I think it's really, really, really important to talaga to always constantly remind the general public about these guidelines then also. So for our next question, this is again for you po, Dr. Faith. This is from Sheila Crisostomo. So based on a research conducted by UP College of Public Health, there is a need to review the DOH's pneumonia vaccination program because the Philippines still ranks 5th in pneumonia deaths. Study showed all 3 pneumonia vaccine formulation may have to be included in the program. May we get your comment on this?
Yeah, that is very true, Ms. Sheila. That is the reason why I commented a while ago na one of the challenges and the weakness in the Philippine setting kasi in terms of pneumonia is that wala tayong solid, credible, and regular data on pneumonia among the adult population, unlike in other countries. Kasi kung wala tayong good surveillance system for pneumonia, mahirap mag-create ng program for immunization for the target population among the adults. Kasi, di ba, when we create program, kailangan merong basis, ano ba yung problema, bakit ganito ang solusyon. Kung wala tayong numbers, kasi wala tayong proper surveillance or solid surveillance data or numbers, mahirap i-justify kasi ang program. So indeed, pneumonia together with other lower respiratory tract infections remain as one of the top 5 causes of morbidity and mortality in the Philippines. And kaya nga kami na mga doktor na mga adult, talagang we advocate, we promote vaccination for pneumonia. Mahirap kasi sa adult kasi parang sa tingin nila, kasi ang bakuna naman kasi hindi din siya cheap, no? And then mahirap i-convince ang adults, especially yung mga adults na wala namang mga comorbidities or the non-senior. Pero ako in my personal practice, actually I through the years I've seen na parang mas gumagaan sila, mas nagiging receptive na yung mga tao in terms of adult vaccination compared to before. And we really need to promote adult vaccination, kung hindi man head-to-head with chikiting vaccination, but we really need to promote this, especially among the vulnerable population. No? Indeed, there is also a need to consider, for everybody's information here lang, my society, the Philippine Society for Microbiology and Infectious Diseases, we did come up with a clinical practice guideline on adult immunization. The last update guidelines was in 2018, and talagang regularly ina-update natin to para magiging gabay or guidance on adult immunization. And as I mentioned earlier in my lecture, last year lang, October 2021, inapprove yung bagong formulation ng pneumococcal vaccine, yung PCV15 at saka PCV20, which studies have shown are much better than the current vaccines that we have. So while I was preparing for this lecture, actually, I had to make calls to find out if these vaccines are already available in the country. Unfortunately, hindi pa, kasi October last year lang in-approve sa US. So let us hope and pray na maging available siya dito sa Pilipinas soon, kasi definitely if they are, this will be the better vaccines that will be offered to the eligible adult individuals.
Thank you po, Dr. Faith, for clarifying also again that question of Miss Sheila. And I think it's really important also to note na these vaccines that are made available also to the general public talaga, dumadaan talaga siya sa proseso. Hindi lang natin talaga siya na basta-basta lang na ibibigay, na ipapabakuna. So I really think very nice also yung tanong, kasi at least nabibigyang linaw yung mga ganong notions also ng general public when it comes to our vaccines. Yeah. So our next question po comes from Caroline Bongkin. So this one is for, I think this is for Dr. Joanna, but Dr. Faith, you can also chime in also to add your thoughts on this one. Hi. Ano po yung city and province na may pinakamaraming bata na hindi pa bakunado?
So Sir Jan, I think nasagot ko po siya kanina. Sabi ko po kanina, yung pinakita po natin na mga priority areas po dun sa screen, yung presentation ko po. Ito po yung ating mga identified na areas. So, kumbaga may provinces and cities po tayo, kada rehiyon, na marami pong hindi nabakunahan na mga sanggol po. Tapos para po sa mga numbers, ang masasabi ko lang po is higit sa 5 hanggang 10,000 bata sa rehiyon na ito, ay sa mga areas na ito, ang hindi nakakumpleto ng kanilang bakuna. So ito po, i-reiterate ko po yung ating fully immunized child or yung mga kumpletong bakuna na kailangan ma-receive po ng sanggol. So ito po yung BCG, yung ating oral polio vaccine, yung ating pentavalent vaccine, at yung ating measles vaccine po. So ito pong 4 na vaccine na po to, kailangan kumpletong makuha po nito. Kaya nga po sila hindi nakakakumpleto dahil nga po nung sa pandemic, marami po tayong mga restrictions or yung mga mobility po ba natin limitado po. Kaya ngayon, mag-focus po tayo sa ating chikiting vaccination days para mabakunahan po yung ating mga bata. Thank you po.
Thank you po, Dr. Joanna, for that answer po. So, Dr. Faith, may nais po ba kayo i-add?
I cannot add. I don't have anything to add to that. Thank you.
Thank you, Dr. Faith po. So we are now down to our last 2 questions that we can accommodate for this Kapihan session po. No? So this question po is for Dr. Faith from Sheila Crisostomo po. Gaano po ang ibinaba ng kaso ng flu and pneumonia?
You are referring during the pandemic times? Ma'am Sheila? Kasi, well, bottom line, wala akong exact numbers for you. But sa mga readings ko, both global incidence and local incidence for flu and pneumonia during the past 2 years, bumaba talaga. When I prepared for this lecture kasi, I tried to get local data, no? And then the best I could get was the one I presented sa PIDSAR 2021. If you remember, I presented na for flu, bumaba by 10%. Yung incidence ng influenza-like illnesses reported to PIDSAR, even the deaths, no? Pero this was data for half of the year, January to July 2021 compared to the same time frame in 2020. Unfortunately, I tried to look for reports or data for pneumonia for local statistics, pero wala po akong mahanap. I really don't know if Ma'am Joanna does have numbers from, maybe they have it in DOH, pero unfortunately, I could not give you exact numbers for pneumonia.
Thank you po, Dr. Faith, for answering the question of Ms. Sheila Crisostomo. So now for our last question, this comes from Isa Umali of DZBB. So ano po ang mga hakbang sa vaccine hesitancy para tahakin ng mga magulang? Mga takot na pabakunahan ang kanilang mga anak. Thanks po.
So ako na lang po sasagot, Doc Faith, okay lang po. So for vaccine hesitancy po kasi hindi naman po talaga mawawala ito sa ating kahit anong immunization program po, mapabata, matanda, meron po talaga tayong issue on vaccine hesitancy. Pero po para sa mga magulang po natin, ang ating Health Promotion Bureau naman po ay patuloy na nagpapalabas ng mga promotional materials at kumbaga yung informational materials po natin para ma-clarify po na yung may bakuna po tayo para sa COVID-19 vaccination at may mga bakuna po tayo para sa mga sanggol na hindi po COVID-19. So dito po, pumapasok yung ating expertise sa National Immunization Program kung paano po siya i-deliver na delineate po yung magkaiba po yung COVID-19 vaccine at routine immunization. Kumbaga po, wala pa po tayo kasi talagang approved na COVID-19 vaccines para sa mga sanggol po sa edad 5 pababa. So kumbaga, important po na clear yung ating messaging na ang binibigay po natin sa mga bakuna, sa mga sanggol ay mga routine immunization. Sa ating mga healthcare workers naman po, ang pagkakaalam ko ay nagkakaroon sila ng mga health promotional activities sa lugar po nila kasi siyempre po may iba-ibang lengguwahe po tayo. So para po ma-explain sila ng maayos, may kanya-kanya po silang promotional activities or information materials na develop po para ma-address yung ating vaccine hesitancy na naka-cater po sa bawat rehiyon po nila. So ayun lang po. Salamat po.
Thank you po, Dr. Joanna and Dr. Faith, for answering and accommodating the questions that came in from our media. I'm really sure na hindi lang ang ating media partners yung naliwanagan sa mga katanungan nila, but also to everyone watching from our Facebook and YouTube pages as well. Ayan. So and there you have it, everyone. So that concludes our Kapihan session for today. Pero syempre, bago tayo magtapos, I would like to call on Dr. Joanna and Dr. Faith again for their closing messages and syempre yung mga pabilin sa ating mga viewers bago tayo kumain ng ating mga masasarap na pananghalian. Ayan. So maybe Dr. Faith can go first and then Dr. Joanna to follow.
Okay, so thank you very much. So once again, thank you for joining this Kapihan, and you people, the media people, you play a very important role in our advocacy for convincing people that vaccines do work. They have worked since the 1800s hanggang ngayon. Nagkaroon tayo ng issue, specifically vaccine hesitancy with specifically with the COVID vaccine, no? Kasi alam kasi natin na bago ito na mikrobyo, bago nga na virus. So marami talaga, understandable na meron talagang hesitant or anti-COVID-19 vaccine. Pero it has been proven for more than 200 years na vaccines save lives, vaccines prolong lives, vaccines improve lives, and hopefully the media people who are here will help us in the medical profession put the word out, the good word about vaccine, to counter the fake news, to counter the the hesitancy and the anti-vaccination sentiments of people, because this is one way. Tayo kasi we are in a developing country, we are in a tropical country. Ang top 10 causes of morbidity and mortality natin, out of the 10, I think mga 5 to 7 are infectious diseases, and these are vaccine preventable infections. So kung maganda yung vaccination program natin against these diseases, malamang matatanggal sila sa top 10 causes of mortality and morbidity in the Philippines. So hopefully, mga colleagues natin dyan sa media, tulungan niyo po kaming ma-advocate na kailangan all of us, kung eligible tayo for whatever vaccine, we go to the doctor, we go to the health center, we go to the clinic and get the vaccines for ourselves. Thank you very much.
Thank you po, Dr. Faith. Dr. Joanna po, pahabol na bilin sa ating viewers today.
Yes po. So actually, super ganda po ng message ni Doc Faith, and I will just like to add a few more things. So ayun nga po, thank you everyone for inviting me in this Kapihan session, which is an avenue to share our knowledge and updates on immunization across life stages. So may it be for infants and actually for adult vaccination. So I hope everyone learned po from our discussion, Doc Faith and I, and hopefully we encourage everyone to get vaccinated for a healthy Pilipinas. So happy Immunization Week po everyone, and please continue supporting our program activities. Thank you.
Thank you po again, Dr. Faith and Dr. Joanna po. No? So maraming salamat po sa pagpapaunlak ng aming imbitasyon ngayong araw. Dahil I'm confident to say na talagang nakapagbahagi kayo ng adequate and very insightful information tungkol sa ating topic, and very timely since we're also celebrating National Immunization Week talaga. So maraming salamat din, syempre hindi natin kalilimutan ng ating mga media partners for continuously being an ally of the DOH and of the entire health sector as well in fighting against the spread of fake news, dahil patuloy kayo sa pagbibigay ng accurate information not just to the Filipinos here in the country, no, but also all over the world. Yun ang pinaka susi talaga para patuloy tayong makapagbigay ng right information to everyone. Ayan. So panigurado, no, sa ating cooperation, sa ating pagsasama-sama, kayang-kaya nating magpabakunan na. Sabi ika nga ng theme, ng tema ng Immunization Week natin. Long life for all, kaya sa healthy Pilipinas. So once again, I'm Jaron Mateo from the Department of Health, at magkita-kita po tayong muli for the next Kapihan session with Nita. Thank you and take good care everyone.